Hello everyone, and welcome to week 2 of Rx 2010. This week we're going to look at dosage calculations and concentrations and percent strengths. We're first going to start with calculations based on pediatric formulas. So it's really important to understand the vocabulary, especially when dealing with these pediatric patients. We consider a pediatric patient anyone under the age of 12. Once they reach the age of 12, if they're the normal size and weight, then we go ahead and we use adult dosing. So we're just looking at those pediatric patients with these three formulas. So keep that in mind. The first formula that we're looking at is Clark's rule. Clark's rule is one of the most common pediatric formulas. It's based on the child's weight, and what we do is we take the child's weight in pounds, we divide it by 150, and it's just a standard 150. It's based on an average person, an average adult, and we multiply it times the adult dose, and that gives us the child's dose. So I've given you an example here of a 10-year-old child who weighs 68 pounds, and they are supposed to receive carbamazepine for seizure disorder. The usual adult dose is 300 milligrams. So since we are being told to use Clark's rule, we don't care how old the child is, we are only going to be using this 68 pounds. So we're going to take that 68 pounds, it's going to go on top of our fraction. The bottom is always 150. Now, when you get ready to put this in your calculator, do this fraction first. So take 68 divided by 150 and hit your equals button before you multiply. And then we're going to multiply by 300 because that is the adult dose. When you put that in your calculator, we rounded this one to the nearest whole number, and we got 136 milligrams. So again, you just want to make sure that you're doing order of operations properly with your calculator. That's usually the biggest problem with these, is that you must make sure you do 68 divided by 150 and hit that equals button just to make sure that your calculator knows what to do, and then do times 300. The next formula that we're going to look at, another pediatric formula, is called Fried's rule. And Fried's rule is very rarely used, and the reason for this is because it's only for patients under the age of 2. So think about that while you're doing your discussion posts this week, that this rule is only for those children who are under the age of 2. So it's not even appropriate for the majority of our pediatric patients. So the first thing that we want to do for this particular formula is to take that child's age and convert it to months. So whatever their age is, we want to make sure we change it to months. So if they're 1 year, 3 months, that's actually 15 months. So whatever their age is, change it to months. And then we're going to divide that by 150 and multiply by the adult dose again. Again, 150 is just a standard number that we're using in the denominator. It doesn't represent pounds this time. It's actually an average month kind of information. So for this particular example, we have a physician who orders amoxicillin for a 6-month-old infant, and the usual adult dose is 500 milligrams. So we're going to take that 6 months, and that's going to go on the top of our fraction. We're going to divide that by 150. Again, do that in your calculator first. 6 divided by 150. Hit your equals button, and then do times the adult dose, which in this case was the 500. And when we do that, we're going to get 20 milligrams. So the dosage for this infant is going to be 20 milligrams of amoxicillin. So that's our second pediatric formula. Our third pediatric formula is called Young's rule. And Young's rule is used more frequently than Fried's rule because it can be used for children ages 1 to 12. It's a little bit different. For this particular formula, we take the child's age in years, and that goes on top of the fraction. Then the bottom of the fraction is the child's age in years plus 12. So if the child's 2, the bottom would be 2 plus 12. And then we take that times the adult dose, and that gives us our child's dose. So here's an example. We have a physician who orders amoxicillin, this time for a 5-year-old child, and the adult dose is still 500 milligrams. So to use this formula, since the child is 5 years old, that's what goes on top. So 5 on top and 5 plus 12 on the bottom, which is 17. So put that in your calculator first. 5 divided by 17, hit the equals button, and then multiply by 500, and you should get 147 milligrams. So this particular child's dose is going to be 147 milligrams of amoxicillin. Now those are the 3 pediatric rules. Unless the doctor specifies use this particular rule, you're not going to use a pediatric formula. You're going to use whatever it says on the actual medication or whatever the doctor says based on the child's weight. So again, unless the doctor specifies use Clark's rule, Fried's rule, Young's rule, you're going to go with whatever else the doctor says. And typically it's just a plain old straight basing the calculation on weight of the child. And that also works for many of our adult patients as well. So let's look at a few more examples. So here's other ways that the doctors might order medication, and this goes for both pediatric and our adult population. They may order the medication in a single dose based on the patient's weight in kilograms. So here's an example of a dose of 4 milligrams per kilogram daily of Plaquenil that is recommended for certain children suffering from lupus. We want to know what would be the appropriate dosage for a patient weighing 47 kilograms. Well, since the medication is based on the patient's weight in kilograms, 4 milligrams per kilogram, we want to make sure that the patient's weight is in kilograms first. And in this case, it already is, so we don't have to do any converting there. Once you have the patient's weight in kilograms, then you're just going to multiply by this dosage amount. So we're going to take our 47 kilograms times our 4 milligrams per kilogram. And we're just going to pop that into our calculator. And when you take 47 times 4, you should get 188 milligrams. So this particular patient is going to get 188 milligrams per day. And it's per day because that's the way it was ordered, 4 milligrams per kilogram daily. So we don't have to split this up and over a certain amount of time. They're just getting 188 milligrams per day. Now, sometimes doctors do it a little bit differently, and it might be a daily amount. So here it's a daily total, but then they tell you to divide it into equal doses. And again, it could be based on the patient's weight in kilograms. So here's another example. We have a child who weighs 76 pounds. They're prescribed the antibiotic cefaclor. It's recommended for the child to receive 20 milligrams per kilogram per day. And then we're going to divide that into doses every 8 hours. So we need to figure out how many milligrams is the child going to take per dose. Well, first things first, since the dosage is based on the child's weight in kilograms and we have the child's weight in pounds, we're going to first need to change pounds to kilograms. You can use a proportion and do that like you did last week in your conversions. But as you will find as you move on and you become more and more comfortable and more familiar with the conversion factors, it just means that we're going to divide by 2.2. So we're going to take 76 and we're going to divide by 2.2 to change that child's weight to kilograms. So when we put that in our calculator, 76 divided by 2.2, let me do that one real quick. We're going to get 34.5, and that repeats. So 34.545454. And usually what I do is I don't round until the very end. So I just leave that big long number in my calculator and I continue on and read the rest of the problem. So the next step of the problem says to multiply that weight, that 34.54, by the amount ordered per kilogram. So the amount ordered per kilogram was that 20 milligrams. So we're going to take that 20 and multiply it by that big long number in your calculator. So 20 times 34.54. And since I left that big long number in, I'm just going to do times 20 and hit my equals button. And I'm going to get 690.9, and it's going to keep going. We're going to repeat 690.909090. So I'm just going to round this to 691 milligrams now. Now that's how much the patient needs for an entire day. Remember, the doctor said now take that entire day and divide it into doses every 8 hours. Since there's 24 hours in a day, that means we're going to divide it by 3. So we're going to take that 691 and we're going to divide it up into 3 doses. So I'm going to take 691, divide it by 3, and that means we're going to get about 230 milligrams per dose. So every single dose that this child takes is going to be about 230 milligrams. So that is an example of basing it on their weight, but dividing the doses up per day. We could also have a total daily dose where they already give you the strength specified. Here's an example where Mrs. Smith is taking 250 milligrams a day. We're dividing it into 4 equal doses, and we want to know how much per dose. So we're just going to divide 250 by 4, and that gave us 62.5 milligrams per dose. Here's another one where they actually specify the amount. So they're taking 20 milligrams per day. But this particular question says, well, how much for 5 days then? Well, we're just going to take that and multiply. 20 times 5 is going to give me 100 milligrams for the entire course of therapy. So it's all about reading. It's all about making sure we understand what the prescription's asking for. We're going to continue with that topic on the next segment, so please make sure you tune in.